life, wisdom. Thank you for tuning in to The Truth Talks. I'm Psyche Truth correspondent Karina Rachel, and I want to begin this video by asking you if you have questions about mental health issues, psychiatric drugs, or if there are any other topics you would like us to cover. In this video, we're going to be discussing schizophrenia, but I hope that you will leave a comment and let me know what other mental health topics you'd like us to cover. So I'm joined today by Dr. Colin Ross. He is an author and practicing psychiatrist based in Dallas, Texas. Thank you so much for joining me.
Hello.
So we did a previous video discussing multiple personality disorder and how it's different from schizophrenia, even though they are often thought to be the same thing. So in this video, can you talk a little more specifically about schizophrenia and its diagnosis?
Well, schizophrenia is regarded as the most severe mental disorder of all, and people who have that label, in fact, consume more psychiatric services, occupy more beds, and cost the gross national product more than any other diagnostic group. But what schizophrenia is actually a very complicated question. It's generally called the group of schizophrenias. So it's not just one thing. It's kind of an umbrella term or kind of a grab bag, and there's a lot of different problems with a lot of different causes thrown into that grab bag. So it's sort of like pneumonia. Pneumonia's got many, many different causes: viruses, bacteria, lung disease, heart disease, cancer. And so there should be many, many different treatments. And we haven't really sorted out what are all these different sub-causes and subtypes and forms of schizophrenia. So we tend to just give it this blanket treatment of antipsychotic drugs. The general thinking in psychiatry is mental disorders are genetic, or at least predominantly genetic, and that's most true in schizophrenia. So the typical line from the mental health field is, we know that schizophrenia is a genetic brain disease, we know it's due to a chemical imbalance, and we know that you're either going to stay the same or go downhill, and you need to take these drugs forever. That's kind of the standard teaching.
So essentially, when you receive a diagnosis like this, you're signing up for a lifetime of treatment, not here's these drugs and you'll feel better in a year or feel better in a couple weeks. I mean, this is something that you're going to have to be maintaining, a maintenance treatment throughout your entire life.
Right, that's the standard approach.
Okay. And so, as we've established in previous videos, you're not a fan of using these psychiatric drugs in treatment, and you actually prefer a therapy-based treatment. Can you talk to us a little bit about your experience treating patients and what treatments you've seen being effective?
Sure. No, so when you're talking about schizophrenia, you always have to be very careful. You can't generalize about everybody. So there's clearly a group of people with schizophrenia who are very burned out, very unmotivated, and there's no way they're participating in any psychotherapy whatsoever. And that's not just one or two people, that's a large subgroup. But there are also within this big category of schizophrenia, a whole group of people who are actually quite capable of participating in therapy and meaningful talk therapy. And there's, especially in England now, a series of well-designed studies showing that cognitive therapy for schizophrenia is probably at least as effective as medications, probably more effective than medications, and you might have a lower relapse rate and a better long-term outcome. So this is not just a belief anymore. We actually have studies and data. But even if you do nothing, if a person meets criteria for schizophrenia, which is all these psychotic symptoms like hallucinations, delusions, very disorganized thinking, and it lasts for at least 6 months, and there's a bunch of deterioration in function and a lot of stress and bad feelings, that's the definition of schizophrenia. So if you do meet those criteria, a third of people at least kind of get better on their own if you do nothing. A third kind of grumble along in the middle, and a third do really badly. And it looks like in the third world, actually, people do better than they do in North America, which is probably a combination of what kind of culture they're in, that's more supportive, less stigmatizing, and probably, sadly, pretty strong testimony that this medication approach isn't working too well.
Right. And especially because, in addition to this being a maintenance treatment, a lifelong treatment, the potential side effects on these drugs are oftentimes way worse than what the person is experiencing.
Well, the older antipsychotic drugs had tardive dyskinesia as a side effect, which is where you get these abnormal twitching, grimacing, writhing, jerking movements that can last the rest of your life. That's a very debilitating thing. Now, the newer ones are heralded as far fewer side effects. It took a few years to figure out, but not a decade, that they have another set of horrible side effects, which is they cause weight gain, rise in blood sugar, bad cholesterol problems, and therefore they're directly contributing to cardiovascular disease and reduced life expectancy.
Wow. And that's one of the major, one of the number one killers in this country is heart disease.
Right. So we're compounding the cardiovascular heart disease problem in America by prescribing antipsychotics. That's simply a fact. It's not me having a bad attitude, or it's clearly in the data and in medical reality.
Wow. And arguably, if someone suddenly having all these cardiovascular issues or blood sugar problems, it's only going to worsen their problem or their depression or whatever is actually trying to be treated.
Yeah, no doubt. There's a study that was in the American Journal of Psychiatry a few years back, I forget the exact date, but like 3 or 4 or 5 years, where there's a bunch of children aged 12 to 18 who had already been on antipsychotics for 6 months or more. And then what they were done was they either were given metformin, which is glucophage, which is an oral drug for diabetes, or placebo. So up to the start point of the study, the average kid had already gained 22 pounds. Mm-hmm. And then during the study, the kids on placebo gained another 8 pounds. So that's a 30-pound weight gain total from the drugs, not normal growth and development. Whereas the ones who got metformin didn't gain any more weight. So we were causing diabetes, weight gain, and 2 of the kids had to drop out of the study because they developed full diabetes, direct side effect of the meds. So we cause diabetes, or like half, 3/4 diabetes in these kids. They gain a whole bunch of weight, their lipids go up, then we give them an anti-diabetic drug, and that dampens it back down. Mm-hmm. So it doesn't take long to figure out if you're an adolescent and you just gain 30 pounds, it's not good for your self-esteem, not good for social acceptance, not good for your health, not good for whether you can make the sports team. Right. So it's not just the physical side effects, there's all kinds of social cost as well.
But, arguably that kid who's now taken all these different drugs just made a lot of money for the drug companies. So, that's definitely a motivation, and especially when we talk about, these a diagnosis like this is creating a lifelong consumer, a lifelong patient.
And the problem with that, like if you have rheumatoid arthritis, in fact, there's no cure for that. In fact, it is a lifelong disorder. It's medically true. You can see it in the person's knuckles, and there's blood tests for it and so on. So clearly there are medical disorders that in fact are lifelong disorders. And you have to try and help the person do as well as they can. So we talk as if that's true of schizophrenia all the time, but our own data in the psychiatry journals shows that for 1/3 of people, they actually get better on their own and don't have schizophrenia for the rest of their lives. So it just isn't scientifically true that it's this kind of lifetime disease sentence. Right. Also, the data in the literature show very clearly that the antipsychotic drugs, besides having lots of side effects, really don't work very well at all. 70% of people who are prescribed antidepressants in the big studies don't respond. That's just the basic facts in the studies.
And then to even further your comparison of rheumatoid arthritis as an example, in terms of the diagnosis, there aren't any biological tests and there aren't any physical ways to prove whether or not someone has schizophrenia. So again, just in the mere diagnosis of the disorder, there's a lot of, area for questioning even the diagnosis, because we should have some biological proof. We should have a physical test to show us, the evidence that we have this disorder, especially if we're about to sign up for a lifelong of rather expensive treatment.
Exactly. So if you call it a lifelong problem, that's different from calling it a lifelong disorder and making a diagnosis. As soon as you call it a diagnosis, you're clearly implying that it's a medical disease.
Right.
Because people don't diagnose being a sports fan. That's not a diagnosis. Right. Even if you're a fanatic sports fan. So the whole thing is very medicalized. We talk as if it's a disease. We treat it with medications. Only doctors can prescribe medications. But we don't actually, in fact, have scientific proof that it is a disease, as opposed to a life adjustment problem. So I think that there's no one answer fits all.
Right.
That there's a large group of people in this category of schizophrenia where there's no identified disease, the meds don't work very well, and we're building more and more evidence that psychotherapy is the way to go, and social support. Mm-hmm. There could be a subgroup in there where it actually is a disease, but we've lumped those people in with all these other people, and it's such a confused mess we can never sort out, really, that little group who maybe does have an actual disease.
So it's been estimated that up to 50% of people with a schizophrenia diagnosis also have substance abuse problems. So my question is, is there any relationship or even a causal relationship between substance abuse and either the development of schizophrenia or just, clearly it's probably common that substance abuse is a coping mechanism, but is it possible that substance abuse in earlier life could cause you to have schizophrenic?
Well, these are all good questions, and they're always chicken and egg kind of problems. So nobody thinks that alcohol just by itself causes schizophrenia. There's some literature that heavy marijuana, not just recreational, but heavy marijuana use for many years maybe increases your risk of developing schizophrenia. But on the other hand, maybe you're smoking up so much to try and dampen down the schizophrenia you're already developing. There's some evidence that clearly hallucinogens can make you psychotic for a short period of time if you have a bad trip. Chronic heavy hallucinogen use maybe can cause a syndrome that mimics schizophrenia to some degree. If you have schizophrenia, it can make it worse. But that a person who never was going to develop schizophrenia develops it solely from substance abuse, pretty iffy.
So for people who are maybe have already received a schizophrenic diagnosis, or who are maybe considering talking to their doctor because they're experiencing the hallucinations or things like this, what recommendations would you give to them about how to find a psychiatrist or a therapist that would be able to give them the help they need?
Well, it's a big problem in North America because psychiatry is so locked into the make the diagnosis, prescribe the meds, and maybe a little housing support model. And people who really are properly trained know what they're doing and can give psychotherapy for psychosis a try are few and far between. There's an organization called the Hearing Voices Network that's international. They're more of a peer support group, so you can look them up online. There's an organization, the ISPS, so it's isps.org. They're an organization pretty dedicated to social causes of psychosis and social and psychotherapy treatments. So they're a good information source, and you might be able to get a therapist through that.
Wonderful. Well, thank you so much, and thank you for tuning in. Be sure to leave your comment and let us know if you have any topic requests or if there is a particular drug or even a particular mental health disorder that you would like us to address in a future video. Thank you so much for giving this video a thumbs up rating and subscribing to the Psyche Truth channel. I look forward to seeing you all again soon.